Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today, I'm at the East La Penitence Health Center. We're observing Vaccination Week in the Americas. Joining me in the program today is Dr. Onika Scott, the Maternal and Child Health Officer attached to the Ministry of Health. Welcome, Dr. Scott. Thank you for joining me on the program today. It's about that time of year again when we observe Vaccination Week in the Americas. Could we start off by you telling us about the team? Get up to date. Every vaccine counts.
And every vaccine does count, really, Alicia. Thank you so much for having me. Vaccination Week is the biggest activity on the calendar each year for all immunization programs around the world, particularly in the Latin American and Caribbean territories. That's when we show the world how important vaccines have been to both the public health initiative and, of course, the clinical initiative in population health. Guyana will not be left behind. We always are on top of things and on top of our celebration because we are split into 13 immunization districts. There have been different launches around the country, of course. We launched, our first launch was in Region 8 on Saturday, and they joined with Lab Week to bring awareness to vaccines. Apart from that, although the launches have much emphasis on having fun, the teamwork, team spirit, the awareness activity, what really counts are those activities that we have during the week. And this year, as last year, we had a special set of activities for Guyanese. We've identified our vulnerable populations or most high-risk populations. So there are dates that are targeting the vaccination of our armed and military forces, vaccination of our teachers, our special need children, those with vulnerabilities, whether they be physical impairment or other vulnerabilities. Vaccinations, of course, targeting the elderly because we do have to protect our elderly against pneumococcal and, of course, COVID-19. Adolescents, too, do have a spot in Vaccination Week because it's vaccination across the life cycle, not just vaccines for the under 1 or under 5 population. So I believe on the last day of Vaccination Week, we're looking at targeting adolescents. Then the public is welcome to several evening vaccination sessions that will be conducted across the country because we want to make sure that we cater for the working public and those who may find it quite convenient to visit the vaccination sites after hours. So 7:30 until 7:30 p.m. at the tarmac of the Ministry of Health, Sophia Health Center, Melanie along the East Coast Corridor, back in Georgetown. I believe we also have East La Penitence Health Center where we are today recording. And today the babies have turned up with their mummies, of course, to have their under 1 vaccination. This is very exciting to see how very disciplined the Guyanese public is. We saw even a few daddies today bringing their children under 1. And that really encourages you because we have established that Guyanese, we have a high sense of health literacy for immunization. It's never been something that we had to work with for that population. And because of that, we have saved lives. A little bit about the theme, though, for Vaccination Week that speaks a lot about getting up to date with our shots. We really do have to focus on our local immunization schedule. We find that many people don't know at the age they are what vaccines they should have had. And we've had rather unfortunate circumstances of people not recognizing the need of travel vaccine. For example, yellow fever has been quite in the news lately, a vaccine required for countries that still have a threat of endemic yellow fever disease. And so if you're going to Suriname or you're going to some of the European territories or even to Africa, and even in the Caribbean and Jamaica, we've had a few people sadly not being able to board their flights because they were unable to show proof of yellow fever vaccination. And getting up to date also means that you remember that we are in the COVID booster era. By now, all of us should have gotten our primary series. And 6 months after each primary series, you are entitled to your booster dose, especially if you're traveling to places of the world where COVID-19 is still rampant. Vaccines such as measles, we do have a migrant population in Guyana, and some of those migrants are coming from areas where, unfortunately, vaccines are not available. And then the Caribbean and Latin American territories, we are still on alert for measles outbreak that are actively occurring in Venezuela and in Brazil. And Alicia, I have to tell you, each year I have to emphasize that Guyana is still measles free after our neighbors are not or have not been. And that really indeed is an achievement to our people, our nation, and of course the Ministry of Health and the vaccination program. Each vaccine count is very important because we want to make sure that we complete the cycle necessary for an individual to attain immunity to certain diseases. And that's a lot for the theme for Vaccination Week 2023.
Indeed. Thank you so much, Dr. Scott. You know, I really look forward to Vaccination Week in the Americas because it provides an opportunity for persons who haven't been updated with their vaccine. So take the opportunity and get vaccinated.
It is true. It is true. The Guyanese public have no excuse. We have our walking shoes on. You'll see nurses in their t-shirts. We're looking through our registers, trying to find all the children who have missed their appointments. We're knocking on doors. We are scheduling vaccination activities at businesses, at ministries, etc. Nobody has an excuse not to get up to date during Vaccination Week. It is the most exciting time for the program and healthcare workers all around the country.
Indeed. Last year, Guyana celebrated Vaccination Week in Brazil in a beautiful cross-border launch. Could you tell us what we should expect this year with regards to the launch and ceremonies that you guys have scheduled and prepared?
Well, as stated before, Alicia, we do have several launches across the country. The hinterland regions have already started quite early. We like to launch a little before the week, so it gives us time to run off the actual activities that's focused on administration of the vaccines. Region 6, Region 5, along with Region 3 will be launching together in Region 6, and they have marches scheduled, bringing out the population to the street, as we would say, just for everybody to, you know, join in that awareness. We do have a closing ceremony that's scheduled in Region 9, and that's on the last day of Vaccination Week. Traditionally, that region always closes Vaccination Week. There are a few other launches in Region 2. I believe they started very early this year. And of course, some of the other regions are doing virtual launches. The ministry tries to support each region in their launch.
Wonderful. Thank you, Dr. Scott. You mentioned earlier about the vaccine life cycle. Could you tell us some of those vaccines that persons should have along the various stages of life?
So within the first year of life, Alicia, and I like that question because I think that all Guyanese should know what vaccines are given across the life cycle. Again, we have no issues with parents bringing their children to the clinic in the first year to receive at birth, and very importantly, within the first 24 hours of birth, their BCG vaccines as well as their hepatitis B pediatric vaccines. Right after that, at a 2, 4, and 6 month schedule, we expect to administer to our children polio vaccines. It can be OPV or IPV depending on the status of the child. We also do give the combined 5 series of pentavalent vaccine, and then there's a PCV13 and rotavirus vaccines. That goes up until the first year of life, going into 12 months, and we add the MMR, measles, mumps, rubella vaccine along with the yellow fever. Around 18 months, there's another booster of some of the vaccines we mentioned before, and a 3-9. And I know everybody looks forward to 3-9 because they're breathing a sigh of relief. My child will exit the clinic, but that's not really so, because if you're looking at vaccination across the life cycle, after we give our 3-9 boosters, which are mostly the DPT and the polio vaccines, we still have to think about the adolescents, and they will get tetanus vaccines at 15 along with HPV that starts at 9 years old to 16. The good news about the HPV vaccine is it's now 1 dose for most eligible groups. The young adult comes into the picture picture where if you're missing your hepatitis B or you are at a high risk group for hepatitis B, could be occupational as well. We give you a series of hepatitis B, and of course, tetanus is every 15 years. The older adults, we haven't forgotten them with the pneumococcal 23 vaccine that protects them against pneumonia, and of course COVID-19 vaccines across the life cycle. There's special groups. We do have varicella vaccines, although it's very targeted and limited. But there are other groups that are composed of children who may fall in a disease risk group that we bring in vaccines for those as well. In our armory, we have just about 17 to 19 stable antigens and some per occasion. So of course, vaccines for the entire family.
Thank you, Dr. Scott. Before we wrap up today's program, do you have any final words of encouragement to our listening and viewing audience with regards to vaccination?
There is a lot of information out there. Understand that the Ministry of Health stands at your disposal to provide you with information that is scientific, that is credible. Guyana has always led the charge, especially for immunizations, routine immunizations under 5 years old. Let us not change that. Let us use Vaccination Week to pull out our vaccination cards, dust them off, ensure that you've gotten all your vaccines that you haven't missed. And if you have missed, the nearest health center will be able to guide you as to what is needed for you at your age. Because as I always love to say, prevention is incomparable to a cure, much better than a cure. So we're in Vaccination Week, and our path has led us to Isla Penitence Health Center. We've interviewed quite many mommies today, and we have a mommy who is very diligent, and she's brought her baby to clinic for all her life to date. Congratulations, mommy. Mommy, how old is baby?
The baby is 3 years, 9 months.
3 years, 9. So you're here for the final haul of vaccines, aren't you? What vaccines is baby expected to get today?
Oh, baby is having her polio and DPT vaccine.
And how do you feel about that?
I'm happy about it because baby's going to be protected against diseases.
Yay, that's very commendable. And the ministry thanks you for your diligence to ensure that baby is vaccinated.
Thank you.
So it's Vaccination Week again, and we have lots of babies coming to the clinic to receive their vaccines. My dear Nurse Simpson, tell us of the process when the children come for their vaccines.
Thank you, doctor. Our process involves when the parents come to clinic. They normally come with a card that have appointments, dates at the back. Once they come with the dates, we collect the card. We take the card up to the clerk to get pulled. Upon pulling, we follow up with a vital sign, which is weighing and measuring, circumference of head. After that, they wait a little until, and then we start interviewing them on that day of clinic schedule. And then we continue that. Upon interviewing, we see if they have to have vaccinated. Once they have to be vaccinated, we vaccinate them. We find out how they do with the child nutrition, let them know what the nutrition made up of. We then chart the card. We have a part of the card that said the child, there's a feeding recommendation as well. We have the part that states the child length for height. We graph it to make sure that the child is within the normal range, mommy. And we show you, and we said, okay, between the two red lines, it means that the child is within the normal range. And below would be under or over. Then we continue to progress. When we finish chart up everything, we explain to the mother, okay, the child is progressing well. We thank her for a job well done. Then we give her, find out if there's any problem with the child, if they want to see doctor. Once there's no problem, we give them another appointment there to continue following up. The child come to clinic from 1 month up to 5 years. Even though the vaccine is at 3-9, you still have to complete clinic follow-up up to 5 years. Then the child will be out of clinic at 5 years. So that's how it goes.
So, mommy, congratulations on your baby girl.
Thank you.
How old is baby today?
She's 2 months old.
2 months old?
Yes.
And baby is due for vaccines?
Her 2 months old vaccine.
Her 2 months old.
Yeah.
How do you feel about that, her getting vaccines?
I am quite excited about it to prevent all infections and disease that is out there.
Excited. That's a favorite word of mine too.
Thank you for staying tuned. Remember to get up to date with your vaccine. Each vaccine counts. I'm Alicia Martin saying goodbye for now.